This is when your body is going through so many changes that you might not even know are happening, because during the first month of pregnancy, most women don't experience symptoms. So you might be taken aback when 2 months later or 3 months down the line, you don't see your period, and then you go take a pregnancy test and discover that you're pregnant. So today I'm going to be telling you everything you can expect during the first month of pregnancy and what to do if you actually think you're pregnant. Let's start with fertilization. Fertilization is the process whereby the sperm from the man meets the egg from the woman. So these two things are needed for fertilization to occur or for a baby to be formed. Now they form a product known as the zygote. The zygote goes on, grows over 9 months to become your baby. All right. So first off, the zygote is just a bunch of cells. And then from these cells come your baby's brain, their spinal cord, their liver, their heart, their skin, their hair, like everything basically that your baby has. That is what this zygote gives off. So after the zygote has formed, it travels down the fallopian tube into your uterus. Your uterus is also known as your womb. So when it gets to your womb, it implants itself into your womb. And this process is sort of like it burrows its way, like it digs its way into your womb. And this digging process can break some blood vessels. And when these blood vessels are broken, they produce blood. Now we're going to get to that blood later, and I'm going to explain its importance much later. So stick around. This is when pregnancy has officially happened. So pregnancy doesn't happen without the implantation of your zygote into your womb. Your body starts receiving signals that you are pregnant, and the signals come in the form of a hormone known as HCG. HCG is the pregnancy hormone known as human chorionic gonadotropin. The HCG hormone then begins to signal your body that you are pregnant. It starts to increase gradually. The more period you are pregnant for, the higher the amount of this HCG. So that's why in the first month, if you take a pregnancy test during this time, the test might read negative because the HCG has not gotten to that peak that it needs to get. And this is where your body can go haywire. Your body can go crazy at this time. You could begin to feel so tired. And this tiredness is not due to stress, okay? It's not due to the fact that you're not sleeping well. And again, it's not due to malaria. So some other symptoms that you could experience are sleeping more, especially during the day. Your breasts could also get very tender and dark. Your nipples could get darker as well. And wearing a bra this time might start becoming difficult because of the tenderness. If you've experienced nipple tenderness or breast tenderness when you're on your period, it's usually worse when you get pregnant. You could also experience nausea or morning sickness. Now, don't be deceived by the name. The fact that it is called morning sickness doesn't mean it is just in the morning that it happens. It could happen in the evening as well. It could happen at night. In fact, it could last throughout the whole day. Mine was evening sickness. I was more nauseous during the evening. It was really terrible in the evening. In the morning, I was so hungry. That's another symptom too that you could have. You could begin to experience like severe hunger pangs that you need to rush to the kitchen and get something to eat as soon as possible. So another symptom that you could experience is bloating. You could just feel like there's so much gas in your tummy, and in fact, you just feel so heavy and slow. Then going to one very important symptom, which I mentioned earlier, implantation bleeding. This symptom can sometimes be mistaken for periods. This is the difference between a period and an implantation bleeding. Your period will soak your pad. So any bleeding that soaks up your pad is most likely not implantation bleeding. Then the color as well. For your period, you could get really red, like bright red blood, especially during the first few days before it begins to get a darker red and then brownish when it's ending. But for implantation bleeding or implantation spotting, the blood is usually darkish red. It could be brownish as well. It could also be pinkish. Yeah. If it turns out to be really bright red, then it's most likely not implantation bleeding or implantation spotting. One symptom that you could experience that is really, really funny is mood swings. You could just go from 0 to 1,000. Like 1 minute you are happy, the next minute you are sad, and the next minute you are angry. Like your body will just be doing so many different things to you. So what do you do if you think you are pregnant? Now, the most important thing to do is to begin to take folic acid. Folic acid is very, very important for your baby's development to help their organs develop well and prevent any abnormalities. Number two is schedule an appointment with your doctor. The third thing you need to do is you need to adjust some of your lifestyle habits. If you take things like alcohol or you smoke, this is the period when you want to cut out all of those things because they are very harmful to your baby. If you need help doing this, there are groups that are available to help you quit these things, or you could talk to your doctor or your midwife and they could suggest things for you that would actually help you to cut out all of these things. Then you need to start eating healthy. Okay, taking fruits, vegetables, cutting out junk food as well. Basically just living a healthy life and reduce your stress. Yes, stress is also a very, very important one that you need to cut out. So I'm making a series about what happens during pregnancy month by month. If you're interested in that series, please hit the subscribe button right now so that you don't miss out on any video. Let me know in the comment section if you have any questions and I would do justice to them. Thank you so much for watching. Bye.